Here with Home Care Assistance for part 2 of Live at Lunch. We're here with Dr. Hicks from Ohio Health with his mobile stroke treatment unit, and he's going to tell you a little bit about what's going on behind me.
So this is an ambulance, but it's not the type of ambulance that you typically see around. This is one of, I'd say, about 24 stroke-specific ambulances in this country. And it's done in collaboration with Ohio Health, who provides the clinical care within the truck. But we also work in conjunction with Columbus Fire, who provides 2 medics on the truck, as well as a CT technologist who also works for Ohio Health, are on this truck, as well as an advanced practice provider, that's a nurse practitioner or a physician assistant, who comes to a scene of a stroke. So whenever someone dials 911, this mobile stroke treatment unit is activated. So if it's at somebody's house or at an apartment or at a nursing facility or anywhere in town, this mobile stroke treatment unit will deliver care to the patient. And what makes it revolutionary is the dome white thing in the middle there. That is a CT scan. So you're able to bring a patient in here with a drop-down device. We're able to drop this down, and myself or any of my stroke neurology colleagues can evaluate the patient on the bed. And after the CT scan is done, the CT technologist sends it to the neurologist, and we're able to look at it and determine whether or not this person is having a stroke or not. And if so, we're able to provide life-saving treatment right there before the patient even gets to the hospital. And although Columbus has fascinating and impactful stroke centers around town, of which we collaborate not only with Riverside Methodist Hospital through Ohio Health, but also the Wexner Medical Center, as well as Mount Carmel East. So these are comprehensive stroke centers, but what we do is we get it started. We figure out what's going on with the patient, and we start treatment, and then we hit the ground running once they get to these respective emergency rooms and hospitals, to rapidly alter the trajectory of a stroke survivor. This amount of time that we save with treatment can be the difference between being discharged home from the hospital or going to a nursing home, or maybe spending a small amount of time at a nursing or at a rehab center versus maybe never leaving the hospital with a devastating significant deficit. So, although it might just be 45 minutes saved or a half an hour saved, that is a amazing difference between how a patient can turn out.
I'm Mike Warnemont, and I'm with the Columbus Division of Fire. Been with them for 26 years and been on the mobile stroke since it started 2 years ago. And I'm one of the 2 paramedics that are on the truck.
My name's Bill Longinette. I've been a paramedic with the Division of Fire for 23 years and have been with the mobile stroke treatment unit since it started 2 years ago. And I'm one of the primary medics on working today.
Thank you. I'm John Ford. I'm CT Tech for 5 years and have been a full-time CT Tech on the truck since it began 2 years ago.
I'm Corbin Willis. I'm a physician assistant. I've been on the truck for 2 years since it started. Been with neurology at Ohio Health for 4 years.
Stroke is sudden, and there are things that you have to know about the common stroke signs and symptoms. You think about the term be fast. Be fast. So B is sudden loss of balance. So that's B.
E is sudden change in eye movements or deviation.
F is facial droop.
A is arms, as in weakness.
S is speech, slurred speech, trouble speaking.
And T is time. Time to dial 911. Be fast. Dial 911.
Well, as we all know, that doctors are also our superheroes, and this is just one great example of how Dr. Hicks is changing the way the world ages by saving lives before they get to the hospital and making sure they get the right treatment. Thanks for joining us.
Appearing for the first time ever in public, this is your Columbus Fire Fireman of the Year, Michael Warnemont.
Oh yeah.